Hi everyone, Dr. Remy from Pain Free and Fit and Posturesize. Today we've got a great presentation on how to determine what your neutral spine position is and the correct RPI tensions for chronic neck pain. Hope you enjoy. So one of the basic foundational exercises that we use in rehabbing and treating chronic neck pain with healing and corrective exercises is to determine what the neutral spine position is of the neck. Now, by neutral spine, we mean the position of the neck and the vertebra that is the safest position to avoid irritating soft tissue structures, such as disc fibers, facet joints, synovial linings, facet capsules, ligaments, muscles, tendons, etc. The key to this is doing an analysis on your body. Now, at the painfreeandfit.com website, as well as the Posturesize website, we have a great free body analysis you can take to determine what type of postural abnormalities perhaps you have in your legs or pelvis that may be abnormally setting the foundation of your spine, affecting your neck, as well as low back and rib cage. But today's video, we're going to scope that down into just talking about shoulder blade and head and neck position, because locally there's a lot that goes on between shoulder blades, head and neck that affects the neck and affects neck pain. And you need to know how to set your body in a correct position before you perform any neck strengthening, any neck stretching, any neck stimulating, healing stimulating exercises. Otherwise, you'll only be strengthening the dysfunction if you're not targeting your unique problems and issues. So to begin with, we're going to check the shoulder blades, because many of the muscles that come off the shoulder blades attach to the cervical vertebra of the neck, including the trap, the levator scapula, the rhomboids have an effect. So normally scapular or shoulder blade function is such that normal posture has a flat front of the shoulder, and a lot of people have rounded shoulders. So if you check yourself and you look down or look in the mirror and see that you have a scooped out or hollow posture to your shoulder, you'll want to take that shoulder and bring it back more towards a neutral position. How much, we'll tell you in just a moment. If you have a tipped scapula, which is the bottom of the scapula moves outwards away from your rib cage, you may need a friend to look behind you to see that. You'll need to push the bottom of the scapula or shoulder blade forward into the ribs a certain degree to realign that. And as you do that, the top of your shoulder blade comes back. Elevated scapula, where when you reach above and do above activities, your scapula or shoulder blade has a tendency to hunch up when you're just reaching up a little bit, not maximally. That's an elevated scapula. You'll need to know how to push that shoulder blade down towards a more neutral position. If you have an abducted scapula, which when you move your arm out to the side, the scapula turns out too much. Many times with these types of people, the arm will be away from the side, versus an adducted scapula where the shoulder blade has turned in downward rotation and the side of the shoulder is lower than the inside of the top of the shoulder blade. So all these corrections you'll need to put more towards a neutral alignment. Many times you won't be able to get a total neutral alignment, but you'll position yourself to a position that feels the best on your neck. Many times you'll be able to take your fingers, place them on the neck, and feel some hypertonicity or tightness in the neck. And by positioning the shoulder blade towards neutral alignment, that's going to decrease the tension. And the exact combination of those corrections you'll want to combine until you feel the least amount of neck tension in your neck. That's the ideal shoulder posture that you'll want to include in your exercise and you'll want to remember. Now, the neck itself is directed by head motion. If you have a tendency to lean your head to one side, that side of the neck is going to be compressed. The facet joints, the discs on that side, the other side is going to be overstretched, often leading to mechanical stress and pain. So you'll want to tilt your head sideways from neutral as far as it takes for you to feel the beginnings of some discomfort. And if that aggravates it, then try going the opposite way. And at a certain point, you may feel a little pulling or stretching on that side. You'll want to position the head halfway between those two extremes, which will be more or less a neutral spine position of straight ahead. With certain cases, you won't be able to get straight. You'll slightly be still off to one side, but it's the midpoint position between feeling pain in one direction and feeling some stretching or pain in the other. You want to be right between those two. You can do the same thing with rotation, looking right and left. If you have a tendency to have a rotated posture in the neck, you'll notice that many times the SCM, the muscle that comes off the side of your skull and down into your collarbone, will be tight on one side, and you'll notice more of a bulging on the side opposite to what your face usually points towards or what you have more range of motion going towards. Again, Look right and left. Any pain, you stop there, mark that as an extreme. Go the other way if you feel pain, mark that as an extreme. You want to place your head right between those two positions. Again, that's going to be more probably ideally straight ahead compared to your typical posture, but still may be a little off. That's okay from beginning the exercises. That's your neutral spine position. You'll also want to take care of forward head posture, which is a problem. Many people, normally the ear is right above the shoulder. Many people have a forward head posture where that ear is in front of the shoulder. You want to position that head back as far as you can until you feel a little tugging in the neck. Mark that as one extreme. Then goose it forward till you feel a little neck pain. Put your head right in the center. That's your neutral spine position in that range of motion. And finally, compression and decompression. We can go up with the head, elongating the neck, and then compress the neck. And you're going to want to feel a little discomfort or stretch at one extreme. You may feel a little pain at the other. You want to position yourself right between those two. That's your neutral spine position in that motion. So we're trying to combine all these different motions into one combined synthetic position. That's the midpoint between extremes of motion. That's your neutral spine. That's your safe position to exercise in and hold your neck in. That's not going to irritate it. You may also want to try some lateral translation of your head, which is just moving from side to side like you're sliding a box. And at a certain point you may feel discomfort. Another you may feel a little pulling discomfort. Put it right between. Same thing with the thorax. You can move the rib cage side to side and get that mid position. Once you've gained that position, you're going to use that position in all of your neck exercises. It's not to say that your neck is not going to be able to move in the exercises, but you're going to try to maintain a neutral position at the midpoint rep of those ranges of motion, so that, let's say you're doing a rotational exercise with your neck, turning it from side to side, you will not want to turn far enough into that extreme of pain, and you'll want to be combining the other corrections such as head retraction, head and neck elongation and compression, and the lateral type of corrections, so that you're using those corrections as you're turning. That allows you to exercise these muscles in a way that supports proper posture, good mechanics, and less stress on your neck and cervical spine. I hope you enjoy this series on neck neutral spine position. There are also muscular contractions you can do for the neck to help hold in a stable position. That's beyond the scope of this particular video. If you'd like to hear more about healing exercises for the neck, feel free to subscribe to our channel. We have a lot of great videos there. Any questions or comments, write in. I'll do my best to answer them. If you'd like to help me share this vital information with others, give me a thumbs up below. I'll do my best to get more information like this out to more of you to help you. If you're looking for a great neck healing exercise program, go to the painfreeandfit.com website. We've got a great healing exercise program for neck pain there that goes through a nice analysis of this and many of the corrective exercises you'll need to tailor fit an exercise program to support your body's healing stimulus of your neck. Hope you enjoyed this video on learning neutral spine position for your chronic neck pain.